All right, so since it is 11:30, just to stay on time, we're going to get going. Again, just for the people that just joined, we will have quite a few people joining in and out throughout the meeting. This is being recorded, so I will post this on the Allen County Department of Health's YouTube channel once we figure out how to do that. So it should be up by the end of the week. So my name is Mary Corman. For those of you who haven't met me, I'm the Public Health School Liaison here at the Allen County Department of Health. We are expecting a guest speaker today, so she will be joining at the end, and I'll introduce her at that point. So for today, here's our itinerary. I'm going to give you a brief overview. I know a lot of you have kind of gotten my emails and understood the different overview of what this role is. We are adding a new course. It's a safe babysitter course for middle and high school students. I'm going to give you an update on the pediatric pneumonia situation. We'll go over some vaping documents that we have available to help you. I'm going to talk about what a communicable disease response plan is and how we can help you either develop that or critique one if you already have it. And then the end of our meeting, we're going to talk a little bit about dental health. There's 2 community partners I'd like to introduce you to. And then we are going to have a speaker from the Indiana Department of Health joining to go over the Hoosier Give Kids a Smile program if your school wants to partner with them. And also just to talk about dental screenings in schools in general. So if you have a question during the meeting, you can hit the raise your hand button and unmute yourself, or you're welcome to just type it in the chat. I'll try to stay on top of that. All right, so again, my role here as the Public Health School Liaison is to sort of be the bridge in between the health department and the well over 150 schools that we have in the county. So first off, I serve as a point of contact for you, just so that you have a face and a name that you know if you ever have any questions related to public health. Feel free, my contact information is up there in the purple box. To jot that down, you can email me, call me, you can text the 414 number, and I'm happy to help you. If it's something I can't do for you, I can at least direct you to the right person within the health department. So a big thing that we see is if you are suspicious you might have an outbreak starting, or if you have a case of some illness that you're unfamiliar with, feel free to reach out to me. And if I am not able to fix it for you, I can direct you to the right person. The blue box, I just want to make everyone aware we made a new web page. So you can click on that link and I will be posting these slides or emailing them if you'd like a copy. But if you just Google the Allen County Department of Health School Outreach, that page will come up. So each month we publish a restroom reader. It's a newsletter that's intended to be hung in bathroom stalls or in front of urinals. This month we just posted the one for November, but October is up as well. October was vaping, and then November is just sort of an overview of how to stay healthy during cold and flu season. We also have a bunch of different one-page PDF handouts. They're great for parents if you have, a case of hand, foot, and mouth disease, or you have a norovirus outbreak. We made little one-pagers just so it's easy for you to get out to everybody. There's also a whole section on vape documents, and I'm going to show you a few of those documents, but that's where you're going to find those. Lastly, I started a program called the Public Health Student Heroes. So we recruited 9 kids from across the county. They're all high school students. And sorry, something just popped up in the chat. I should check in that. So those students are working really hard. They are creating PSAs for the schools. Their topic right now is on vaping. So they're creating videos, audio clips. They're making infographics, slogans. So we are hoping to get those out to the schools in November. And then their next topic they'll be working on is fentanyl overdoses. So just keep in mind when those deliverables are ready. We'll be sending them out to all of the superintendents and then to the private schools as well, individually reach out to you. But we do hope to have those posted onto the school website page as well. In the green box, these are all the different classes that we're doing. Every class and every training we do is always free. So that's just a sampling. You can see on the right, that's the paper that I sent out to everybody. If there's a course you would like us to develop, or to develop, everything we do is evidence-based. So just let me know if there's a topic you'd like a course on, and we're happy to come in and teach any grade level. I've done a few schools where I was there the full day, and so we just did every class period the same courses. So let me know. That kind of gives you a summary. The Glow Germ hand washing has been really popular. And then the dental health for little kids has also been really popular. And lastly, we have free certifications and trainings for both students and staff. So if any of your teachers need CPR AED training, we can do that for free. We're also offering a 1.5 hour stop the bleed certification. Safe babysitter is going to be aimed just for students, and I'll cover that here in a second. And then Catch My Breath is a vaping curriculum. It's typically taught as a 4-part course, so it's 4 30-minute classes that I can come in and teach your kids. It's 1 day a week, or I can train your teachers in how to implement that course. So if you'd rather me just come in on a teacher development day, I can come in and train all your staff on how to teach Catch My Breath, and then they get access to the full curriculum. So if they want to teach it multiple times in a year or teach it multiple class periods, it's whatever really works best for you. So at this point, does anyone have any questions? Hi, Mary. Thanks for joining. If you could go ahead and put that in the chat if you have any questions, because I have everybody muted. Okay, so our new Safe Sitter class. So we were getting quite a few requests for actual certification for students for CPR. We are limited to the number of kids, so I can come in and do trainings on CPR for full classrooms, but because of the student to teacher ratio, we're not able to give the CPR cards if we're doing a full class. So this is sort of our little workaround for that. So if you have a few kids that need a CPR certification, we can do a small, just student only, just CPR class after school. But what this course offers is it's an 8-hour class split over 2 days. So we're estimating around 3 to 7 p.m. We can also do it all at once. If you'd rather have me come in on like a day over Christmas break or spring break, it'll be about a 7.5-hour class if we do it all at once. So it's broken up. It's the full Safe Sitter Essentials course. And if you'd like more information on that, I can send you the link. So that has been around since 1980. And it's a full course that teaches basically kids on how to take care of kids at different age ranges, how to run a babysitting business, how to keep themselves safe. So there's a lot of role play on what to do in different scenarios. And then instead of just the brief overview of first aid, they will get the full American Heart Association CPR AED for adults, children, and infants. And then we bundled that in with Parkview's Infant Safe Sleep course. So that's one of the classes that I can teach. It's about a 45-minute class by itself. And it just teaches kids on how to safely put babies down for a nap. And we talk about shaken baby syndrome, how to avoid that situation as well. So again, this is totally free. Normally people charge about $100 a kid for Safe Sitter if you go through their typical program, but we're providing all of the workbooks and all of the time. All we need from the school would just be a classroom after school and at least one other adult in the building. So it is limited. There's only 6 kids per class because of that CPR ratio, but we can do as many of these classes as you'd like. I actually would really like to get a couple of these scheduled. Since I just got my certification to teach Safe Sitter, they want me to start getting classes on the books. So if anyone would like to be the guinea pig for this class, that would be great. All right, I'm going to give you an update on their pediatric pneumonia situation. So a few of you have been working with Laura Weaver. She's the supervisor for infectious disease and case management here. If you're unfamiliar with this, we have been seeing a rise in pediatric pneumonia. It's a definite rise in the county, it's statewide, and they're seeing it actually all over the country. So at this point, you're not required to report. We're just asking that if you are getting reports of pneumonia in your students or staff, if you'd like to help us kind of get a baseline for how many cases we're actually seeing, it's really helpful to us. So if you are hearing some of your kids are out for pneumonia, I can send you the line list. It was also in my email that I sent out a few weeks ago, specifically on this update. So all you need to do is fill out the line list. You don't have to have all of the information in it. So whatever you can get is great. And then you can just email me those line lists as you update them week to week. So you don't need to wait till you hit a certain threshold. You can just send us those as you get them, and then we will contact you if there needs to be any follow-up. But again, we are seeing a rise in this. Luckily, the providers in the different hospitals are more aware of it now. So we're starting to see them identify the pneumonia quicker than they were even a few weeks or months ago. So if you have questions on this, please email me, let me know. I also put Laura's contact information up there, and I let her know I'd be bringing this up at the meeting. So at this point, we don't have any formal updates from the Indiana Department of Health. They're just asking us to continue tracking the situation. Okay, so for vape education, I'm just going to briefly touch on this. So we funded Macmillan to pay for these courses for vape education for middle schoolers at Macmillan for any public school. But we are also offering some courses because I know there are many, many schools that are not in the Big Four districts. So if you would like me to come in, I can teach the 4-part Catch My Breath program. It's excellent. It's evidence-based. It comes with everything we need. If you would like me to teach your teachers on how to train that, or sorry, train your teachers on how to teach that, it's about 2 hours. I can come in and get them completely certified, get them set up with accounts, and then they can teach that to as many classes as they'd like. I've also created a condensed version. So I have a condensed 1-hour course on vaping. It has demonstrations. We hit on all the key points of Catch My Breath. It's just a little bit less interactive. We don't get to do the role play or the breakout sessions. But if you're crunched for time and you'd still like one of us to come in and talk about vaping, that program is developed and it's available. Also, we have created a large number of digital resources. This is just a sampling of them. So there's a school policy guide on if you're not sure how to address vaping in school. I made a parent guide, and then we have a lot of one-pagers. So this is just some screenshots from the parent guide I wanted to share with you. It's a long document, but I tried to put as many different learning styles as possible into this. So it has everything from suggestions on talking points. It explains what vaping is. And then there's a whole section at the end just about addressing misinformation. And it does have all the resources and research cited. So if they have questions, this is a great packet you could send out as a PDF if you don't want to print all the pages. One thing I wanted to make you aware of is in the chat, if you could just say yes or no. So we are being made aware of this issue with Galaxy Gas. It's a new issue with kids. And all it is it's condensed nitrous oxide, so it's laughing gas. And Nicole, the vaping materials are all posted on our school outreach website. So if you just Google Allen County Department of Health schools, it'll be the first thing that pops up. And there's a whole section for the vape materials. But for the Galaxy Gas, what this is it's actually used for culinary purposes. They're condensing nitrous oxide, and they put it into these cans that you can buy on Amazon. And it's a way to make like homemade whipped cream. The issue is a lot of kids are buying these cans and they're getting high off of them. It causes a fairly strong euphoric short-term high. Pretty much every school that I've been in, I've been hearing about these from either teachers or the students themselves. So this is just something to be aware of. There are actually reports of people dying from this. So they get so much of the nitrous oxide in their lungs, they become deprived of oxygen, lose consciousness, and pass away. More commonly, we're starting to see issues with nerve damage, heart attacks, just different neurological issues. But if you're seeing students dizzy, fainting, just something to be aware of. Also, maybe let your SROs know. I don't know what they do if they confiscated a whipped cream can from someone, but this has just been coming up and I had never heard of it before. So it is a misdemeanor if someone is caught using this illegally or selling or distributing. So even though it's legal to buy, misuse is still considered a misdemeanor charge. So just be aware of that. It's not that it's toxic in and of itself, it's just how it's being used. Okay, so communicable disease response plans. For any of you who were part of our COAG grant program, this was one of our requirements. So this is just a document. It is not required for anyone else. It was a requirement of that grant, but that's expired now. So what I'll do, I actually am rewriting this to make it a little bit less confusing because it was a little bit convoluted in the earlier version. But we will send you a paper And you basically fill out the main contacts and what your school has in place now in the event of an outbreak. It's broken into 3 sections. They're a little bit redundant, so you can do copy and paste, but it's basically how to know who to contact, who's doing what, and what documents you need in the event of a disease outbreak. So we help you kind of identify, what do I need to do just preparing for an outbreak? What do I do if I'm nearing outbreak status? Like I'm seeing cases, but we're not quite there. And then what should we do if there is an outbreak? These documents are really helpful because you might think that it's all common knowledge and you might think everyone knows their role. But some of the issues we see is, what if someone's out on, maybe maternity leave? Or what if one of your key people that knows everything gets sick and is out? So these documents allow us, and we can kind of guide you through how to fill it out. It's not meant to be really time consuming. We just want to make sure you're completely prepared, and we can let you know which forms to develop templates for, who has access to the documents, where are these different immunization records stored. So it's more of just making you think about everything you may not think of until you're in the event of an outbreak. So if anyone would like to do one of these, I'm happy to work with you one-on-one. It is absolutely not required, but just shoot me an email, say you're interested in developing a plan, and we can work together and get that plan for you. And then it's just a nice preparation to have on hand. Okay, and I'm going to talk really fast because I'm a little bit behind schedule. Um, so our main topic I wanted to get to today is dental screenings in schools. So February is Dental Awareness Month for kids. So I'm going to have our guest speaker kind of talk about the Hoosier Give Kids a Smile program. But overall, we would just love to see more schools doing dental screenings for the kiddos if it's something that they are able to do. Pros of this, so the Hoosier Give Kids a Smile program can give you free dental kits if you want to have something to give out, to kind of kick off an event in February. You can sign up for that through November 15th. So we'll talk about it more here in a minute, but I just wanted to put that on the slides. Dental sealants and the exams themselves are not painful. I know some kids are scared of the dentist, but most of what you can do in schools, you can do pain-free. And our hope is to kind of catch those kids who are not going to dentists elsewhere. So we know a lot of families regularly go to dentists. This isn't really what these screenings are for. We're trying to catch those at-risk kids. And again, you can start small. You can do just your first graders. And then the goal is to sort of scale up as you go. The downsides, follow-up treatment. So things like getting cavities filled, that can be scary for kids. And some of the partners will actually do those treatments right in your building. But I know some schools don't really want to have that headache added. So it's something to think about with some of these partners that are full service dentists in the schools, is who's going to be holding the kids' hands while they go through this. Will the kids even be willing to do it if their parents aren't there? Not all programs offer follow-up care, so some of them you do have to refer out for. And another thing to remember is Medicaid typically only pays for 1 yearly exam. Sometimes it's 2 per year. So if you're doing a screening in school, just make sure that you understand how the insurance works, so you're not using up that one visit that the parents may have wanted to use. And then for managing consent forms, Mary Hess from Fort Wayne Community was great. She gave me a breakdown. Fort Wayne Community has a great program already in place with Neighborhood Health. So Neighborhood Health was actually one of our awardees for the Department of Health's Health First. So we gave them $30,000 to expand their in-school dental programs. So I called and talked to them. They are absolutely looking to expand beyond the Fort Wayne Community Schools program, but they said they are filling up really quickly. So they may not be able to get people in until next school year, especially if you're looking for multiple schools. So Keisha's contact number is there in yellow. She can kind of give you an overview if you're interested. This is a trusted community partner. They do a great job with Fort Wayne Community. So what Fort Wayne Community does is they have the parents fill out the consent form at registration at the beginning of the year. And then when they schedule the screenings, they can do sealants and fluoride. And then they have 2 locations in Fort Wayne that they can refer out to, or the child can just go to their normal dentist if they need a filling. So Medicaid is billed, and grants cover the exams for anyone who doesn't have Medicaid. The other partner, and I'm going to speak real quick on this, is School Smiles. So this is a group, they're not working in many schools in Allen County yet. They have a bigger presence down by Indianapolis, but they do complete dental care for kids, and they can do all of that within the schools. So same thing, you call and schedule. The only thing the school is responsible for is the original consent forms. So they will handle all of the insurance. They handle all contact with the parents. The issue here is it's again whether or not you want to have them do the full services at your school. So what they'll do is they'll do the initial screenings, and then anyone who needs follow-up care, you can schedule a second time for them to come in, and they'll actually do all the fillings, everything that you need right in the building. So it's a really great option. Ryan, his contact information is down there. I told him to expect some calls. This group I'm very, very impressed with. I've been talking to them for a few months. And they actually only have a 2% referral out rate for people that need follow-up care. They do 98% of it in the schools themselves. So if you have questions, there's no cost for the school, but feel free to give him a call. He is looking forward to people contacting him. All right, and we have a guest. Nellie, if you can unmute yourself for me. And so Nellie Chawla, or Dr. Nellie Chawla, she is the director of the Division of Oral Health down at the State Health Department. She has been a great asset to me. She's helped me a lot with different dental programs, and she is going to speak about different dental screenings. Nellie, do you want to share your screen, or are you just going to be talking?
Yes, I'm going to share my screen.
Okay, I'll go ahead and stop sharing.
Yeah.
All right, and I apologize for talking over. So go ahead. Thank you so much for being here for us.
Yeah, and thank you so much, Mary, for having me here in such a great communication channel. Appreciate all the great work you're doing and being such a great oral health champion for the past 2 years. So glad to be here and talking to you all about oral health, about the resources we have created, and how you all can be an oral health champion in your own little way possible. So I'm going to share my screen. Okay. Are you able to see it?
Yes.
Is this okay?
Yep, I can see it. If anyone can't see it, please put it in the chat. But yeah, I can see it, Nellie.
Okay. So I'm going to stop my camera so that we can see the slides. So just talking about little about the oral health in school children. Are you able to see the slideshow, oral health in school children?
Yes.
Okay. So I'll start with our mission and vision of the Indiana Department of Health, which is to promote, protect, and improve the health and safety of all the Hoosiers, no matter where they live, and learn, work, or play. So why do we need to talk about oral health? Because oral health does matter. Our total health and wellness, it cannot exist without oral health. And US Surgeon General David Satcher said it as a silent epidemic. So when oral health suffers, so does the ability to learn, grow, and enjoy life. And too many children, they have oral health needs that are going unmet for too long, and which has a detrimental effect on both their current and future health and well-being. So to give you all a little background about what dental caries is. So dental caries is the most common chronic disease of childhood in US. It is chronic, it is infectious, but it is preventive. It is not self-curing, and it is expensive to treat, but it is inexpensive to prevent. According to American Dental Association and the American Academy of Pediatric Dentistry, our caries is 5 times more common than asthma. And early childhood caries, it's severe, it's rapidly progressing form of tooth decay in infants and young children. So we all know about the dangers of poor oral health, besides leading to bad breath, tooth loss, gum diseases. It is also being related to a heart disease, stroke, dementia, and diabetes. And did you know that the oral health is important for the overall health and well-being? Yet 1 in 5 Hoosier kids, they suffer from untreated tooth decay. half of our Hoshiers, they live in an area with a dental health provider shortage. And over 4 in 10 children have tooth decay by the time they enter kindergarten. Children who have cavities in their primary or baby teeth, they are 3 times more likely to develop cavities in their permanent and adult teeth. So according to the stats, a quick stats that 3.6 million Hoshiers, they live in dental health professional shortage area, which is around 53% of the state population. And $45 billion is lost in productivity due to the untreated dental disease. And in the state of Indiana, as Mary just also mentioned, that the school-based dental health programs, they are so less, it's around 4 to 6% schools who provide fluoride varnishes or sealants on a regular basis. So we all know that oral health disparities exist by age, gender, geographic location. There are 2 to 3 counties in the state who do not have a dentist, and 1 county who do not have a dental hygienist and a dentist. And just 5 local health departments, they provide oral health services in the whole state. So this is the map which shows 3 counties without a dentist and the dental shortage area counties in the state. So we all know the consequences of dental caries. It is like, it's not covered by Medicaid all the time. And some people, they do not have the time and resources to get to dental clinics. And throughout assessing good oral health, it's like going through a series of locked doors. And if people do not have the key they need, they won't be able to open the door. So the main aim of talking to you about today is I wanted to share a story of a Demonte Driver. He is a 12-year-old boy who lost his life because of dental caries which got untreated. The infection from the abscess in the tooth, it got spread to the brain, and the child could not be saved. We do not want this to happen. We know that dental caries is preventable. So you all make a difference. So today I want to talk to you about what we can do. We can definitely reflect on the profound impact oral health has on children, and Let's Champion Oral Health is an integral part of our holistic care. So Hoshier Kids Smile program, as Mary rightly mentioned, this program takes place in the month of February every year, which is a National Children Dental Health Month. Last year, Allen County did a great job in spreading the news and promoting oral health among the schools. And I'm reaching out to you all this year again. It's an initiative which is dedicated to promote oral health among children in the region. Let's empower children with the knowledge and resources they need to maintain excellent oral health. Your participation in the program could have significant impact. We have made few educational videos which can be found at the Department of Health website to educate the children about oral health. You can order free toothbrushes and kits from American Dental Association until November 15th. In the month of December, you will come to know whether your school is going to get the number of kits you have ordered. If suppose the school is unable to get the number of kits you have ordered, you can definitely reach out to Department of Health, to me. My contact information will be at the end of the slide so that I can provide you with the additional kits you need to educate your kids in the school. It's a beautiful program, so let's all be part of this program. In this slide, I have included the steps to fill out the form. When you go to the ADA website, how can you order the toothbrush kits from the website? Step-by-step information is included on the slide. The another 2 things which I wanted to share with you is the oral health curriculum which the Department of Health has made through a grant through CDC. So this curriculum is suitable for grades K to 2. It is known as Super Smiles, a dental health adventure. So it meets multiple state and national health education standards and include lesson plans, videos, printable activities with instruction, visual aids, and parent caregiver handouts. So if any school wants to incorporate this curriculum into their school education, I'll be happy to provide you with the links and all the resources needed. If the initial schools, 100 schools which reach out to me, I'll be happy to provide a mouth prop model for them to provide a hands-on training in the classroom to the children with a big toothbrush and the mouth props. Another thing we have made is the children's basic oral health screenings. So what exactly is the children basic oral health screening? These are just the visual screenings of the oral cavity, which takes around 1 minute. The reason is to triage these children in the schools who are in need of care. This may be the first time you have an opportunity to look into the child's mouth who have no access to dental care. The screening can be done by a school nurse, a school liaison, or any non-dental professional using a pen light or a flashlight to look for any signs of first sign of dental disease. So we have trainings which are available. These are 30-minute trainings. These are all virtual trainings, but we'll be happy to provide in-person trainings for the schools who are ready to train their staff, school nurses or school liaisons for these trainings. So we'll be happy to do that. You can definitely reach out to me to know more about these trainings for screenings. So again, this is just 1 minute quick screenings. No x-rays are taken in this, and you cannot see the decay which is in between teeth, but you can definitely catch the first sign of caries which is going on in a child's mouth, and we can help you with the resources to refer the child to the dentist in the same area. We have made a list of dentists who take low-cost dental treatments or the dentists who are taking Medicaid patients. So we'll be happy to share that list with you so that you can share it with the parents and quick screening results to the parents. So main takeaways for today is that oral health is connected to our overall health, and it can affect one's quality of life, physical, social, and mental well-being. Tooth decay is chronic, but preventive with proper oral hygiene, and prevention is the key. So definitely you cannot educate a child who is not healthy, and you cannot keep a child healthy who is not educated. A nice words by our US Surgeon General, Jocelyn Elders. So thank you so much for joining in today and having me today to tell you and walk you through the oral health resources with the Department of Health. So I'll be happy to take any questions if you have. Thank you.
All right. Like she said, if anyone has any questions, I really appreciate you guys hanging in there. I know I talked way too much at the beginning. So we're a few minutes over, but thank you again for joining. This was our first Lunch and Learn, so I will probably try to get a little bit less into the next one. But we will be doing this monthly, so I'll be sending out a calendar invite monthly. If you do not want to be on that list, please just send me an email and let me know to take you off. So Mary Hess, I know you are sharing this with all the Fort Wayne community nurses, so they are removed from the list. So that way you can just kind of get that out to them individually. But thank you all. If you have questions on the dental health, Dr. Chawla is a wealth of knowledge. She's really, really helpful. So reach out to me or reach out to her directly. And I appreciate everybody's time. If we don't have any questions, I'll let you guys get back to your afternoons. But thank you so much to everybody for joining today. Any last questions? All right. Thank you so much, everybody. We will see you at the next Lunch and Learn.